All right, joining us now, the top-ranking Democrat in the Senate, Minority Leader Chuck Schumer of New York. Senator Schumer, we're going to talk about this this massive bill in just a moment. But first, a tale of several types of leadership. You see India, you see the UK locked down. You see our president saying we're going to reopen at Easter. Do you think that's possible?
I would leave it to the medical authorities. Mika, I've been busy writing this bill, so I haven't been able to consult them. But it shouldn't be a politician who decides this. It should be the medical authorities, plain and simple.
How do you think this bill is going to help the American people?
Well, that's what's so important. This has been a long 5 days, but the bill is much better than the bill that was introduced. And let me go over it so people know what's in it. Before I do, I want to give a shout out to the healthcare workers, the nurses, the doctors who are risking everything to help us. They are great. And just another little shout out. My staff did an amazing job on this bill, led by Jerry Petrella and Megan Tyra, a couple. And I thank them and all the staffs who worked so hard. Now, in the bill, there are 5 things that are greatly improved. And if we had a title for the bill, it would be Marshall Plan for Hospitals, Workers, Not Corporations First. And let me go over each. First and foremost, there's massive amounts of money for our hospitals, our nursing homes, our community health centers. They are on the front lines. They are so lacking equipment. Ventilators, we know all about that, and there's a serious lack there. Other kinds of equipment as well, PPE, even new beds and things like that. There is $130 billion for them, a considerable increase from the original bill. Second, workers first. All these people who are being thrown out of work through no fault of their own. We've created something called unemployment on steroids. If your employer has to let you go, they don't let you go, they furlough you. And unemployment insurance pays you all, for almost all people, their whole salary or close to it. And that's for 4 months. We got that extended to 4 months. And so it's not just a one-time payment. It's long-term, help you with your mortgage to pay the bills. And then what's good about it, because you're furloughed, when, God willing, this crisis is over, these businesses can reassemble. One of the things the workers and the employers worry about is what's going to happen to all the people who are a team, who work together so well. That's number 2, workers first. And we put real responsibility. As you know, there's a $400 billion package for corporate loans. Under the original bill, no one would know who was getting the money and what the terms were for 6 months. We have real accountability, transparency, and oversight. We will know each contract when it is signed, fully published within a short period of time. Congress in 7 days, the public in 14 days. And we have an oversight board and an inspector general that's really tough, has subpoena power, and can look at every one of these contracts. These are many suggestions of Elizabeth Warren, who's an expert on this. And 2 more pillars, money for local governments and state governments. As you know, they're running out of money. That's what we hear from governors, mayors all across the country. There's $150 billion to help them survive the crisis. And finally, small business. And this is the one thing of the 5 that was in the bill originally, the way we wanted. And small businesses, my dad was a small businessman, exterminator. I know how business people struggle, and now it's worse. You spent years of blood, sweat, and tears building up your little business, and now it's gone. Well, this will give you short-term, very low or no interest loans, so you can keep your business going and pay your employers to stick with you. So this package is big help, quick help for the American people, right in the places we need it most. First and foremost, our healthcare system, and second, to all the people who are under duress and losing jobs through no fault of their own.
So, Senator, so much to go over here. First of all,
yes.
Congratulations to you.
Thank you.
Democrats, Republicans, everybody working together to bring this in for a landing. Very important for so many reasons. Let's start, though. Let's go down that list. Start with hospitals. $130 billion for hospitals. Where does that relief go? How does it get there? And does it do anything on the issue of ventilators, masks, the protective gear that those healthcare workers so desperately need?
Yes, one of the first and most important things of our hospitals bill is that they get lots of money, good amounts of money, to buy the equipment that they need, and it also puts money into the system so more of these things can be produced and produced rather quickly. When there's so much money out there, there's an incentive to produce more. I believe the president should have used the Defense Production Act. We encourage him to do that in the bill. We can't force him, but this plan gives money directly to hospitals and other healthcare institutions so they have the money, the purchasing power to get these ventilators, these masks, these PPEs. It also allows them to hire more nurses and doctors. It allows them to build more beds, and it's flexible. So if you need a nurse and she has a child at home, you can use these monies indirectly, but it's allowed to help pay for some child care so the nurse who had been retired or who was not on the job could come back right now in this emergency.
So let's go next to unemployment benefits. You say unemployment on steroids. Okay, a worker has been put out of work, has lost their job over the past week or two. They're now going to be furloughed. They can get unemployment benefits for up to 4 months. When does that begin after the president signs the bill?
It begins almost immediately for two reasons. One, we greatly reduce the restrictions on applying for unemployment. It's going to be very simple and very easy. And second, we give the states much more money to hire people so they can take the new loads that are coming. We've all heard of the inability to get through. People call, they can't get through, there are long lines. They will be able quickly and easily to hire people to help people get on unemployment quickly.
Let's talk next about small business loans. I know so many small business owners who, like you say, work their entire life to build up their small business. They've seen it wiped out in the past couple of weeks. I was talking to an attorney yesterday who has about 40, 50 businesses that he handles. He said every one of them, including huge corporations, getting wiped out. But if you're a small business owner, if you had, let's say, a big event coming up in April, and that's been wiped out, and you're facing bankruptcy, how do you get that relief, and how quickly can you get that relief?
Again, and then here, Ben Cardin, Marco Rubio have done a very, very good job. Jeanne Shaheen on our side as well have done a very, very good job here. And you get the relief very, very quickly. The loans are at no or low interest, so you don't have to go bankrupt. And at the end, and your workers are all paid by the federal government. So you get loans to help pay the expenses you have with no income coming in, you know, mortgage, insurance, utilities, if you have those. And your workers are paid for by the SBA. And again, just like unemployment insurance, you can do it quick, and we give much more money so they can hire many more people to get people to do this.
So one of the better parts of the bills, one of the better changes of the bills was converting this slush fund that the president could throw wherever he wanted to throw it. And by the way, I would say this of a Democratic president. A Democratic president shouldn't have that power any more than a Republican president should have that power. So this has nothing to do with Donald Trump. This has everything to do with a system that's fair to Republicans and Democrats alike. So you're going to have 5 people on this panel. And you're also going to have an inspector general. Who appoints those people, and how quickly does that help get out to these larger businesses?
Well, there's the president appoints, but it's the advise and consent of the Senate, so there's a real check on them. And one of the great ways we get accountability is making sure the entire loan documents are published very quickly. So if they start doing something untoward, you'll know about it, Joe. You'll know about it, very shortly thereafter, within the maximum of 2 weeks. We'll know about it, and there'll be an outcry, and they will have to stop doing it. I think, Louis D. Brandeis, I think it was, sunlight is the greatest disinfectant. We throw a whole lot of sunlight here, and that's really important. The old bill, you wouldn't know for 6 months anybody who got the loans, etc. So this is very, very important. And frankly, Elizabeth Warren, who's had experience with this with the TARP, helped us, had many suggestions we incorporated into making the accountability provisions.
Which leads to my final question, which you may disagree with, but I want to get it out there. I talked about it earlier, how important it is that Donald Trump's companies be treated just like everybody else's companies, since there's transparency, since we will know who gets it, since you put in those checks and balances? Don't you think it's important that Donald Trump and senators and congressmen and women's businesses are treated the same and are eligible for these funds, so no one will be encouraged to make policy decisions based on getting their own businesses open? Is there any way we can do that?
I think the danger is much greater the other way, Joe, that if they get a financial interest, then they'll make policy decisions leaning and bending in that direction. Look, I've always believed, I think you believe, that those who make the laws shouldn't directly benefit monetarily from those laws. We've tried to get better and better and better at that. And this is just another example. It's not aimed just at Donald Trump, but at anyone in high office.
At the same time, somebody shouldn't be punished because they've chosen a life of public service. And I'm speaking of members on both sides of Congress as well as the White House. And again, if they go bankrupt, if their companies go out of business, then they're susceptible to untoward influences, more susceptible than before.
Well, Joe, it's not just me who disagrees with you. It's the founding fathers. They had something called the Emoluments Clause, which disagreed with your philosophy and said the public office holder shouldn't benefit.
No, that's not correct, though. That's two different things. I agree with you on the Emoluments Clause. I certainly agree with you that Donald Trump shouldn't use his hotel in Washington, D.C. to make money off of the presidency. In this case, though, we're just talking about businesses, again, senators, congressmen, presidents, businesses impacted by an act of, we'll just call it an act of God.
You and I are going to have to disagree on that. I think the danger is the other way.
Okay, Mika?
Senator, I'm wondering what information that you're taking into your office about New York City, which looks like it's going to be ground zero, the epicenter of the crisis as it hits the United States, on par with Italy, maybe worse, potentially a week away from being completely overcrowded, and already stories coming out of hospitals that are really, quite frankly, hard to hear at this point. Many are very shocked that we are so lacking in our ability to keep up with the demand and the need for help that is out there. Is there anything more the president can do, that Washington can do, to help New York get out of this situation?
Yes, there is. The president should implement the Defense Production Act. I called him. I was feeling so urgent about this, having talked to so many. I talked to heads of many New York hospitals. I've talked to the head of the nurses union in New York, things like that. And the president should enact the DPA and command certain factories, which was done during World War II, Korean War, to make things that we need. He's not doing that.
Senator,
so we've
why
had the second
won't
best.
he?
Wait, can I just?
We don't understand. Why won't he do it? This is simple.
Here is my experience. I called him at about 11:45 a few nights ago, and I said, oh, no, this was at 11 in the morning. It runs, the days and nights all run into each other. It was at about 11 in the morning. I said, Mr. President, you ought to implement the Defense Production Act. Just implement it. He says, yes, I will. And I wasn't there. He must have been in the Oval Office. He screams out to someone, get the DPA implemented. By the afternoon, he had backed off. I can't figure it out. This is something we desperately need. If you talk to our New York healthcare providers, they're desperate for ventilators. They're desperate for PPE equipment. Some places they don't even have enough swabs so they can do the tests because they're now getting many more of the tests. This is inexplicable is the word I'd use.
Senator, is the math as simple as this? If the president would actually enact it and focus mobilizing equipment and supplies getting to New York, less people would die. And every day that he waits, more people will die because supplies will not get there as fast. Is that the bottom line?
He should certainly do this. Now, we have the second best alternative. All our hospitals and our healthcare providers throughout the country will have large amounts of dollars, and that will inspire companies to start ramping up production of things like masks, like nasal swabs, like tests, and like ventilators. But it would be best if the president would do it, that's for sure.
New York needs it now. New York City needs it now. Not, ramp up supplies, wait a few weeks for the production to happen, and actually then look at deliveries. We're talking about today.
As I said, I feel your anguish. I've talked to people in this situation. I just can't understand why the president doesn't do it. I can't understand it.
Yeah. It is. It really is shocking. It's inexplicable. Senator, we have one more question for you. Jonathan Lemire with the Associated Press
Yes.
is
Hi,
with us.
Jonathan.
Would like to ask you a question.
Hi,
Yes.
Senator.
Hi.
I know this is
Hi.
just now completed. It still has to go to the House for a vote. You know, we will see the timeline. This will be rolled out over the next couple of days. There's already talk that this won't be enough. How will you and your colleagues there make the decision? When will you make the decision as to when you have to reconvene to figure out the next stimulus package, if indeed this drags out for weeks and months?
This is a big, bold package, $2 trillion. That's about as much, a little more than the actual whole federal budget. And it covers large areas. I've only been able to mention a few, the 5 I've mentioned on this brief time we have. But inevitably, there are going to be new problems that come up. Inevitably, there are going to be new things we have to do. And one of the great anxiety-causing parts of this crisis is we don't know the future. We don't know enough. I just asked a well-known doctor friend of mine, not well-known, but he's a well-established, and I said, do you establish immunity from this after you get it once? They said, we don't know yet. As well as the isolation. You know, we New Yorkers love to be together, and we have to be separated, as you mentioned. So I think the odds are high we're going to have to do something again. We have to see in the next few weeks what other problems haven't been solved. This bill is a good bill. It doesn't have everything I'd like in it, and there are a few things in it I don't like. But overall, we need it and need it fast. It's big, bold, quick relief for the American healthcare system and the American worker. Workers First has been the name of our proposal, which is now in large parts in the bill we're voting on today.
All right.
Senator Chuck Schumer, thank you.
Senator,
Thank you. Thank you.
A Marshall Plan for hospitals and workers. Thank you so much, and thank you for Republicans and Democrats alike working together on this. We greatly appreciate it. Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.